Hello.
Alright, I'm about to take you through the adult pre-screening exercise tool. The
Yeah.
purpose of doing this is to ask you a series of questions to gain as much medical information from you as I can. This is to try to identify a thing called contraindications to exercise. Contraindications means anything that is present that can be harmful to you while exercising. It can be something as simple as a sore shoulder through to something more serious like heart problems. I'll be asking questions in stage 1 and then going through to stage 2. In identifying these contraindications, it helps me to determine what an appropriate level of exercise is for you and as an intensity. It also helps me to determine what exercises I should put you through in your workout program. The pre-exercise screening tool also tells me if I need to refer you to get a medical clearance from a doctor. Are you happy to go ahead with this?
Yes.
Alright. Okay. So first things first. Has your doctor ever told you that you have a heart condition or have you ever suffered a stroke?
No.
No? Okay. Do you ever experience unexplained pains in your chest at rest or during physical activity or exercise?
No.
No? Do you ever feel faint or have spells of dizziness during physical activity exercise that causes you to lose balance?
No.
No? Have you ever had an asthma attack requiring immediate medical attention at any time over the last 12 months?
No.
No? If you have diabetes type 1 or type 2, have you had trouble controlling your blood glucose in the last 3 months?
No.
No? Great. Do you have any diagnosed muscle, bone or joint problems that you have been told could be made worse by participating in physical activity or exercise?
No.
Great. Do you have any other medical conditions that make it dangerous for you to participate in physical activity or exercise?
No.
No? Awesome. So you've answered no to all the questions, so that means we can go on to stage 2. So if you're happy with that, I'll just get you to sign and date.
Today. No.
Alright, then we'll just flick over to stage 2 here. Okay, so what age are you, Michael?
20.
20, which is great, so you haven't got a risk factor there for being over 45 and male, and of course you're male. Have you ever had a family history of heart disease, as in stroke, heart attack?
No.
No? Okay, great, so there's no risk factors there. Do you smoke cigarettes on a daily or weekly basis?
No.
No? Awesome. Alright, describe your current physical activity or exercise levels. Would you call yourself sedentary, light, moderate or vigorous?
What?
Light. Alright, and how many times per week would you do physical activity?
I don't know. A couple times. I don't know at work. Really, it's what I do.
And how long would you do the activity for?
10 minutes, 20
10
minutes.
Alright, I'll put it for 20 minutes. So that gives you one risk factor for that. You don't do, the recommended minimum is 150 minutes per week
Okay.
of physical activity or exercise at a vigorous activity level.
Yeah.
Okay, so we've got this one there. Okay, your height,
176.
176. And your weight,
86.
86. Okay, so that gives you a BMI of, what are we, 176. Gives you a BMI of 27.8, which is great, so there's no risk factor there, because you're actually under the 30 kilogram meter squared BMI,
Okay.
so that's great. Have you been told that you have high blood pressure?
No.
No. Awesome. Have you been told that you have high cholesterol?
No.
Have you been told that you have high blood sugar?
No.
No. Great. Okay, so that just puts you at 1 for your risk factor, which is great. That means you can now go on to moderate to vigorous activity. Alright. Okay, so then we'll just go to here. Have you ever spent time in a hospital, including the admission for any medical condition, illness, injury during the last 12 months?
No.
Are you currently taking a prescribed medication for any medical conditions?
No.
Are you pregnant or have you given birth in the last 12 months?
No.
No. Do you have any muscle, bone or joint pain or soreness that is made worse by particular types of activity?
No.
Okay. That's one. Okay, so yeah, so you're a moderate risk client. Sorry, you're a low risk client. So you may participate in aerobic physical activity or exercise up to a vigorous or high intensity. So that means an aerobic activity which a conversation generally can be maintained uninterrupted or at an intensity that may last up to 30 minutes. Also means an intensity that generally cannot be sustained for longer than about 10 minutes at high. Okay, that's that one.